there's no way around it. If a child tests positive, they are a positive case and they do need to go home to isolate. And that would mean that we would recommend quarantine for their close contacts.
So lots of parents want to know, does that mean the whole class needs to quarantine? The answer, it depends. Usually anyone who is unvaccinated needs to quarantine after an exposure. But in the school setting, Chris Arisman with the Minnesota Department of Health says other factors will come into play. For example, if kids are not old enough to be vaccinated yet and they were wearing their mask, usually they are not going to be asked to quarantine.
If you have a case in a classroom setting who was masked and their contacts were masked, the contacts don't need to quarantine. That's based on exposures in the indoor classroom setting, not in sports or any other activities. And it doesn't apply to adults, it's just for the students.
If the infected student and their student contacts are not masked but are vaccinated, they still don't need to quarantine. But if the students are unvaccinated and unmasked, they would need to quarantine and get tested. So how about the parents?
Unvaccinated parents would need to quarantine, but vaccinated parents would not have to quarantine, but would rather be recommended to test at the 3 to 5 day mark and wear a mask for 14 days until they get a negative test.
Health officials say fully vaccinated parents, teachers, and staff facing exposure should continue to follow CDC guidelines, which recommends testing. If there are no symptoms, fully vaccinated close contacts do not need to quarantine at home following an exposure, but should wear a mask in indoor public settings for 14 days or until they receive a negative test result. Those who are unvaccinated and recently had close contact with a person with COVID-19 should quarantine until they meet criteria to return. But Arisman is hoping it doesn't get to that point with proper mitigation efforts and testing in school.
Each of the elements of mitigation provides something different, but what testing provides is the opportunity to identify cases early so that we can make sure that people are appropriately isolated and that potential contacts are identified.
For VaxFacts, I'm Charmaine Nero.
So why won't unvaccinated kids wearing masks be asked to quarantine after exposure? MDH points to the CDC, which says transmission can happen between students, but studies show adult-to-adult transmission is more common in that setting. So with that in mind, they are balancing the needs of students to be in school and the need to quarantine. And MDH officials want to be clear, while they provide the recommendations, it is up to the individual school districts to set policies.